Hi, welcome in. My name's Nani. I'm going to be your nurse today. How are you doing? Good. Okay, well, so today you're here for a cranial nerve exam, right? Okay. Before you begin, have you had a cranial nerve exam before? Just a couple of times. Okay, so you kind of know what we're going to be doing, but just in case, I'm still going to go over a couple of things with you as we go through them. I'll, talk you through everything. And I will be jotting down some notes on my little notebook here to the side, just to make any notes of anything that is abnormal or normal as we go along, okay? Can I please have your name and date of birth? Okay, and just verifying here in my notes that everything matches. All right, perfect. And do you have any allergies that I should know about? Okay. Yep, that's noted on here as well. And nothing that we're using today should fall under your allergies, so nothing to be concerned about there, okay? All right, perfect. Very good. So I will be putting on gloves just because there are a couple of tests that we're going to do where I will have to touch certain parts of your face, your shoulders, things like that. Is it okay with you if I touch you like that? All right, perfect. I'm just going to put on some hand sanitizer. And I'm going to put on the gloves for now. So really quickly, let's start off just with assessing your level of consciousness. Obviously, you're answering my questions, so that's always good. However, I just want to ask again, can you tell me your name? Okay, very good. And can you tell me what year it is? Okay, do you know what month it is? Okay, very good. All right, and can you tell me where you are right now? Okay, perfect. And can you tell me what you're here for today? That's right, perfect. Cranial nerve exam. All right, very good. Ready to begin? Okay, perfect. Let me just jot down real quick. Patient is alert and oriented ×4. All right. So we're going to start with cranial nerve number 1. This is going to be the olfactory nerve. So for this, I'm going to ask you to please close your eyes, and you're going to cover whatever nostril I tell you to cover. And then I'm going to bring a certain scent up to the opposite nostril, and I want you to inhale. Okay, and then I want you to let me know what it is that you're smelling. Now, these are items that should be pretty recognizable to you. However, if you get it wrong, but it's kind of close, or if you can describe what you're smelling, that's also great as well, okay? All right, perfect. So can you go ahead and close your eyes for me? Okay, now I want you to cover this nostril. All right, very good. And I'm going to bring this up to your nostril, and I want you to sniff. Okay, and what do you smell? Lavender. Okay, very good. Let me just put the cap on this. Okay, and then I want you to cover the opposite nostril. Very good. And I'm going to bring this up to you again. And what do you smell? Coffee. All right, very good. We normally do pick things with stronger smells, that way, stronger scents. That way it's things that people are more likely to recognize. Now I want you to keep that same nostril covered. Okay, and I'm going to bring this other item up to you. And I want you to tell me what you smell. Vanilla, very good. Okay, now switch back to the other nostril, please. All right, remember to keep your eyes closed. Okay, and now tell me what you smell here. Sesame. Very good. All right, perfect. So I'm just going to jot down real quick your cranial nerve number 1. The olfactory nerve is patent and intact bilaterally. Very good. You can open your eyes again, by the way. All right, very good. So now we're going to test cranial nerve number 2. This is going to be the optic nerve. All right, so for this, I'm going to ask you to cover each eye, and then I'm going to give you a little paper to read, and I'm going to ask you to read this chart, and then I'm going to check your peripheral vision, and then we'll move on to the next cranial nerve, okay? All right, perfect. So can you please cover your left eye? All right. Now I'm going to hold this up to you here, and I want you to read this line. Very good. And this one. Very good. This one. Good. This one. Good. Can you read this one? Perfect. Okay, and what about this one? All right, perfect. That's all good. Okay, now I want you to switch and cover the other eye, cover the right eye. All right, very good. Now once again, with your eye that is uncovered, I want you to read each line, okay? Start with this one. Very good. This one. Good. This one. Perfect. This one. Very good. This one. Okay, and this one. All right, very good. Perfect. So your vision seems to be well with that. Okay. Now I'm going to come behind you, and I'm going to move my hands around, and I want you to say now when you see my fingers in your peripheral vision, all right? Okay. Okay, very good. Now, same thing, I'm going to move my hands, and I want you to say now when you see my fingers fluttering in your peripheral vision, all right? Okay. Okay, very good. Okay, perfect. So let me write that down as well. Cranial nerve number 2, your optic nerve, is patent and intact bilaterally. All right, very good. So now moving on to cranial nerve number 3, I'm going to be shining a light in your eye. It'll be a little bit bright, but hopefully not too bad, okay? So I'm going to ask you to just look straight ahead at me. You can look at the tip of my nose, okay? Okay, and keep your eyes open. Try not to close them when I shine the light on you. All right. Okay. 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 All right, very good. Now I want you to look at the tip of my pen, and I want you to follow it with your eyes, but don't move your head. Okay, very good. So perla is present. That means that the pupils are equally round and they're reactive to light and accommodation. Okay, now I want you to keep following the tip of my pen, okay? And don't move your head, just your eyes. Okay, very good. Very good. Very good. Perfect. Okay. And I didn't notice any nystagmus, ptosis, or strabismus. So basically there wasn't any shakiness in your eyes, there's no drooping in your eyelids or anything like that, okay? So cranial nerve number 3, and this is also 3, 4, and 6 actually. that we just tested. All of them are kind of interlinked. So that's the oculomotor, the trochlear, and the abducens cranial nerves were patent and intact bilaterally. All right, very good. So now I'm going to test cranial nerve number 5. This is going to be the trigeminal nerve. Okay, so I just want you to clench your jaw. Okay, and I'm just going to palpate. Keep it clenched. Very good. Okay, your muscles are nice and strong. Now I'm going to ask you to close your eyes, and I'm going to touch your face with a couple of different items. One of them is going to be hard, one of them is going to be soft. So when I touch your face, I want you to tell me if what you felt was soft or hard, okay? All right, go ahead and close your eyes for me. Okay. What do you feel there? Okay, good. Good. Okay. Okay. Okay, perfect. Good. 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 All right, perfect, very good. So, cranial nerve number 5, the trigeminal nerve, was patent and intact bilaterally. You were able to feel everything very well. All right, now moving on to cranial nerve number 7, since we did already check cranial nerve number 6 earlier. So for this, I'm going to be testing your facial nerve. Okay, so I'm going to ask you to smile for me. Smile really wide, so much that your cheeks hurt. All right, very good. Now can you frown for me? Okay, perfect. And can you raise your eyebrows as high as you can? All right, perfect. Now I'm just going to ask you to please puff out your cheeks. Okay, now keep them puffed out. I'm going to try to press on them, but just try to keep them puffed out, okay? Okay, perfect. Very good. Everything looks even there. So cranial nerve number 7, the facial nerve, is patent and intact bilaterally. Now the reason why we say bilaterally is because even though we say that there are 12 cranial nerves, they're actually in pairs. So in your brain, you have each set on each side of the brain, like each half of the brain. Yeah. So we just want to make sure everything's equal, right? Yeah. Very good. So now we're going to move on to cranial nerve number 8. This is going to be the vestibulocochlear nerve. So for this one, I'm going to ask you to cover your ears. Okay, very good. And I'm going to, well, don't cover them yet. Okay, so for cranial nerve number 8, the vestibulocochlear nerve, so this one's going to be all about the ears, okay? So I'm going to ask you to cover one ear, and then I'm going to come around and I'm going to whisper a couple of words behind you. And I want you to repeat the words that I whisper, okay? And then I'm going to ask you to cover the other ear. I'm going to come around behind you again, and I'm going to whisper some other words, and I want you to whisper back whatever you hear, okay? All right, perfect. So I'm just going to come around behind you. Okay, now can you please cover your left ear for me? Okay, and I'm going to whisper behind your right ear. Ready? Cat, picnic, hat. Can you repeat those words? Very good. I'm going to repeat 3 more words. Horse, shoelace, potato. All right, very good. Now can you uncover that ear, and I want you to cover your right ear. I'm going to come around onto the left side, and I'm going to whisper some words again. All right. Cat, Okay, repeat those for me. Very good. Okay. Mushroom, pizza, chair. All right, very good, perfect. So your hearing seems to be doing well. So we're just gonna write down here, cranial nerve number 8, Vestibulocochlear, you know, sometimes people pronounce it different. So the vestibulocochlear nerve is patent and intact bilaterally. Very good. So now we're going to test your glossopharyngeal nerve. So this is going to be cranial nerve 9, but we're also going to be testing your vagus nerve, cranial nerve 10. So for this, first I'm going to ask you to just stick your tongue out for me, and I'm going to use this light, and I'm just going to look at it, and I'm going to try to look at your hard palate and your soft palate. So try to open your mouth as much as you can, okay? Okay, very good. So stick out your tongue and say ah. Okay. Okay, very good. Everything seems to be rising normally. I don't see any lesions. Okay, very good. So now I'm going to ask you to take a sip of water, and this is going to be to just make sure that everything's working as far as you're swallowing, that you don't have any difficulty with swallowing, okay? So I've got some water here. I'm just going to hand that to you. All right. Very good. No trouble there? Any pain, any discomfort with swallowing? Okay, very good. Now usually for the vagus nerve, we also test the gag reflex. I don't have a wooden palette, but what we can do is use this clean Q-tip, okay? So I'm going to ask you to open your mouth and say ah again, and I'm just going to poke this close to your uvula towards the back of your mouth, and we're going to stimulate your gag reflex, okay? I know it can be a little uncomfortable, but it's just to make sure everything's working, okay? So can you please say ah one more time and stick your tongue out? I'm just going to shine a light on there, make sure I can see. Okay. Okay, very good. So that seems to be working fine as well. So that was cranial nerves number 9 and number 10. So the glossopharyngeal and the vagus nerves, and those were patent and intact bilaterally. Very good. We're almost done here. So we've got 2 more nerves to go over, okay? So up next we have cranial nerve number 11. This is the spinal accessory nerve, all right? So I'm just going to ask you to raise your shoulders for me, but I'm going to be pressing down against them, and I want you to try to overcome that resistance, okay? All right, so raise your shoulders for me. Okay, very good. Now I'm going to ask you to move your head side to side, so like this, but I'm going to be putting my hand against your face, your head, so I want you again to try to overcome that resistance, okay? All right, move your head to one side. Very good, and move your head to the other side. Very good. All right, perfect. So that was cranial nerve 11, the spinal accessory nerve, and that was patent and intact bilaterally. Very good. So finally, cranial nerve 12. This is another one involving the mouth and the tongue. This time I won't be putting anything in your mouth though, okay? So once again, I'm just going to ask you to stick your tongue out. This time, don't open your mouth and say ah, just stick your tongue out, so straight out, okay? And I'm just going to be looking at it with the Penlight just to make sure everything's good there, but I'm going to be checking to make sure that everything is symmetrical, that there's no tremors, things like that, okay? All right, so stick your tongue out for me, please. Okay, very good. Everything's symmetrical. I'm not noting any tremors there, and it's right at the midline. Okay, Very good. And the final step now for that nerve is going to be, I'm going to ask you to repeat a couple of words for me, and I'm going to be looking here to make sure that you can pronounce the words properly. So usually when we pronounce some words, you want to articulate using the tongue and the lips and the teeth, right? Okay, so I'm just going to be making sure that everything's working there as well. So I'm going to ask you to repeat the words light, tight, dynamite. Can you do that for me? Light, tight, dynamite. Okay, very good. Once more, light, tight, dynamite. Okay, can you whisper them for me? Light, tight, dynamite. Light, tight, dynamite. All right, perfect. Very good. So I'm going to jot that down as well. Cranial nerve number 12, the hypoglossal nerve, was patent and intact bilaterally. Very well. So that concludes our cranial nerve exam for today. So everything according to my notes was patent and intact bilaterally. So that means that I didn't detect any abnormalities in your responses and your reactions to the tests, okay? So that's a good thing. That means that your cranial nerves are most likely intact, right? So I'm going to be putting in those notes into our chart, and that way our provider, the doctor, can look over them and follow up on anything that they want to follow up on. Do you have any questions for me? Yeah, they'll probably get back to you fairly soon. We don't have a whole lot of patients that need to do these cranial nerve examinations. This does tend to be just for patients that have had some type of issue recently that raises a concern about the cranial nerves, right? It's not like a routine examination that we do for everyone, really. We just do a couple of them every now and then, right? Yeah, so in regards to getting back to you about the results, the doctor should probably be getting back anytime within the next week, I would say. Yeah, of course. And again, if there's any issues, they'll schedule a follow-up appointment for you. But again, I don't think that there were any issues in today's examination. So anything that they might want to follow up on might be more just to make sure that everything remains working just fine in the future. Yeah. Okay, perfect. Thank you so much. It was lovely to see you today. Yes, of course. And well, I'll see you next time. Next time you have an appointment, I'm always here working. So, all right. Yep, very good. Thank you so much. Bye.